condition. The only problem is in the dental part or in the teeth, and therefore they are usually diagnosed and referred by the dentist. So let's try to fit the pieces of the puzzle together. When to suspect HPP, and this is very important. If you have a child with recurrent fractures, deformities, rachitic manifestations, premature loss of teeth, unexpected myopathy or arthropathy, severe respiratory infection and compromise, in addition to low serum alkaline phosphatase, high calcium, hypercalciuria, high phosphorus, in addition to rachitic manifestations. Putting these together, fitting the pieces of the puzzle, please think of HPP. Put the lab, clinical and radiological features. كلنا لما بنشوف حالات الريكتس بنبقى expecting الكالسيوم يبقى low أو low normal. بس لو لقينا rachitic manifestations in addition to high calcium, low alkaline phosphatase, think of HPP. And these are the latest guidelines for HPP published in the British Medical Journal, setting criteria for HPP, more than one clinical finding, low alkaline phosphatase, and you have to exclude other causes. So back to our case, how to confirm the diagnosis, of course, by genetic testing. Encoding mutations in the tissue, non-specific alkaline phosphatase. And don't forget to exclude differential diagnosis of HPP, like vitamin D deficiency rickets on top of the list, osteogenesis imperfecta, dentinogenesis imperfecta, chondrodysplasia, osteopetrosis, osteopenias, myopathies, and arthropathies. Of course, these are very important to be excluded, and they share some common features of HPP. But none of them is going to have these criteria in the orange box. Low serum alkaline phosphatase, hypercalcemia, hypercalciuria, and hypophosphatemia. These are very unique for HPP and not the other causes. So always think of HPP. In addition, it's really important to use appropriate age range specific when interpreting alkaline phosphatase levels. Another point is that we need to be aware of the barriers that stands in front of the diagnosis and management of HPP. So what are the barriers in diagnosing such a rare disease? First of all, doctors do not usually think of low alkaline phosphatase. Please, let's train ourselves to start looking for low alkaline phosphatase. كلنا لما بنبص على التحاليل بندور على الالكالاين فوسفاتيز العالي، لكن عمرنا ما بنحاول نشوف هو واطي ولا لا. So we need to diagnose this and to look carefully. We need to establish clear age-matched reference ranges for alkaline phosphatase. We need to establish clear cutoff for alkaline phosphatase to define HPP. We need to exclude other differential diagnoses. As you've seen, we have unique diagnosis of HPP. To educate physicians who might refer cases of HPP. ممكن حضراتكم تشوفوا الحالات دي قبلينا، البيدياتريشنز، الدنتستس، الأورثوبيديك سيرجنز، كل دول هم الفيرست بوينت اوف كونتاكت اللي ممكن يشوفوا حالات hidden HPP. And to establish facilities for treating severe cases of HPP. And so to break the barriers against diagnosis and treatment of HPP. I think that we need to put future plans for HPP. First and most important, we need to train ourselves to think of and look for low alkaline phosphatase, not only high. To establish lab facilities for alkaline phosphatase measurement with pediatric reference ranges for each age group, neonate, infant, child, adolescent, and adult. To exclude other differential diagnosis based on diagnostic criteria of HPP. To educate physicians who might be the first point of contact for HPP before reaching the pediatric endocrinologist, to establish facilities for treating severe cases of HPP, and finally, I think we need to raise awareness about HPP. Yes, it's a rare disease, but it's there, and we need to think of it, to diagnose it, and to refer it. Now, the treatment of HPP is mainly supportive, and until some time it was only supportive, with no definitive treatment in the form of fluid, low calcium formula, treating craniosynostosis deformity, physiotherapy, and referring to the dentist. And the question, is that all? Fortunately, that's not all. Now there is a definitive treatment, a cornerstone for treating HPP. وده الحقيقة اللي بتقدمه AstraZeneca. Now there is a definitive treatment for HPP, both targeted enzyme replacement therapy to treat HPP. And I really think this is a turning point. It's going to save the life of those infants, children, and adolescents, and to offer a better quality of life. So this is the definitive treatment. This is aspartame alpha. It was FDA approved to treat HPP in October 2015. And it works by cleaving PI from inorganic pyrophosphate. So it can combine with the calcium to form hydroxyapatite crystals. And this leads to the formation of strong bones, which is the main etiology for treating such disease. It also reduces the levels of systemic inorganic pyrophosphate, the active form of vitamin B6, and therefore it improves the neurological symptoms as well. And this is how it works, mainly promoting hydroxyapatite crystals, which is the main founder of bone formation, binding inorganic phosphate with calcium and promoting more mineralization of the bone and creating strong bone. So I think it's important to take the first step, because the journey of 1,000 miles begins with a single step. And it's time for us all, as pediatricians and in all our specialties, to take the first step. Let's take the first step. And basically speaking, the first step is to suspect HPP. Please start thinking that this disease is there. It's rare, but there. And look for low alkaline phosphatase. And then you can diagnose HPP, and then we can put a plan of treatment, which is our final target. But let's start and take it from there. Don't forget to think of the low alkaline phosphatase. Don't forget to look at the labs for reference ranges of alkaline phosphatase to diagnose and treat HPP. My final conclusions are, HPP is rare but there. So please look for HPP in rachitic patients with high calcium. Remember to look for low alkaline phosphatase. Age-matched reference ranges for ALP are needed for proper diagnosis of HPP. وأتمنى إن احنا يكون عندنا reference ranges للalkaline phosphatase in every age group، لأن هي فعلا بتختلف جدا من سن لآخر. Suspect HPP in any infant or child with rachitic manifestations, hypercalcemia, hyperphosphatemia, and low alkaline phosphatase. And suspected in a child or adult with premature loss of teeth. Remember that there are some areas in the diagnosis and treatment of HPP that could be overcome. And we are happy that there is a real treatment for HPP being now available to save their children. Hoping our dream comes true, saving those children, and it's great to know that treatment is there. Thank you very much for your attention.
Many thanks, Professor Rasha Tarif. طبعا محاضرة أكثر من رائعة، ويسعدني ويشرفني تقديم البروفيسور